You're watching Access Minnesota. Here's Jim Dubois.
Now, here's our conversation with political science professor Larry Jacobs on the public sentiments toward Obamacare. Larry Jacobs is the Walter F. and Joan Mondale Chair for Political Studies and the Director of the Center of Politics and Governance in the Humphrey School of Public Affairs at the University of Minnesota. He's also a political science professor here at the university. Larry, welcome back to Access Minnesota.
Good to be with you.
The re-election of President Barack Obama in 2012 was viewed by some as being indicative of broad support for the Affordable Care Act. However, since the rollout of the ACA, we've seen numerous problems with the website, and the polls are looking rather dismal right now for the Democrats and the president. Tell us about that.
Well, there's no doubt that the bungled implementation in terms of healthcare.gov, which is the federal health insurance exchange, has really put the skids on momentum behind health reform and its implementation in this very early stage. Now, the key thing to understand is that only about 14 or 15 states have implemented their own health insurance exchange, like Minnesota, MNsure. But for states like Wisconsin and others that said, no, we don't want to do this because we are opposed to Obamacare, their citizens can go to the federal health insurance exchange, which is what this is really like a Amazon.com that you might go to buy a new pair of pants or a shirt or something of that order. But it just was not set up right. Minnesota has a very functional health insurance exchange. California, Washington State, Kentucky, other states that did their own exchange are for the most part off to the races. They're enrolling more and more people. Not too many problems at this point. But in Washington, it's still struggling, and that's really put the damper on public support.
And what are the polling numbers stated so far? Are we seeing consistency across the board? What does it look like for the president and the Democrats?
Well, it's bad news at this point for the president, for Democrats, and for the Affordable Care Act. The Affordable Care Act has always been highly contested, of course. The Republicans didn't vote for it when it was in Congress. Not a single Republican voted for it, despite some real negotiations that went on in the Senate behind closed doors, then the big battle over whether it was constitutional, and then, of course, Mitt Romney running on repealing it and replacing it in the 2012 election. So this has been, kind of a ground war between the parties, and that's always depressed public support. But after the bungled rollout in Washington, we've seen support drop about 5 to 10 points further. So at this point, a recent poll by the Kaiser Family Foundation, nonpartisan, trusted source of polling, shows that only about 31% favor health reform at this point. That's dropped down about 12 points from where it had been for a number of months and really years.
When we look at those polling numbers, as you mentioned, is there a need to differentiate between the public's attitude toward the Affordable Care Act and the attitude toward the less than desirable rollout?
I think so. I mean, clearly the rollout has put a lot of downward pressure on those poll numbers. It's very unpopular, and it's one of those things Democrats and Republicans agree on, that it was bungled. And at this point, you've got a bungling Washington, and that's never popular. One thing to note, though, is that even though the Affordable Care Act has been unpopular and the idea of Obamacare has been unpopular, when the Kaiser Foundation has gone back to individuals and said, okay, you don't like health reform, you don't like Obamacare, what do you think about getting rid of pre-existing conditions that would have barred people who, let's say, had breast cancer in the past from getting insurance or charged them far higher premiums, and a number of other of the core features of reform. You find those to be very popular. 2/3 of Americans, up to over 80% of Americans, supporting the reforms that are being put in place by Obamacare. So there's a dichotomy or a schizophrenia where the political football known as Obamacare, not so popular, much less popular today after the bungling. But the actual reforms, very popular, to the point you even hear Republicans saying, well, we'd get rid of Obamacare, we'd replace it with, and they usually list the very popular things. The real trick there, though, is what you replace it with it's going to look a whole lot like what President Obama and the Democrats passed. There'd be a Republican spin on it, but it's still going to have government regulation. It's still going to have some kind of subsidies, and on down the list.
What do you think the chances are that the Affordable Care Act can be resurrected, the popularity can come back? Is there something that could be done? Obviously fixing the website first and foremost among those, but is it too late for President Obama? Does he still have a chance to sell this idea on the American public?
Well, it's a great question. I think there is a kind of conclusion at this point that it's all done for the Affordable Care Act. But I don't see any reason to think that. It's obviously going to depend on what happens with the federal health insurance exchange. But what I've seen from logging on and the reports we're now getting about the progress on the Affordable Care Act's implementation in Washington suggests that it is starting to work. What we've seen in the states conclusively shows that the core idea of having this kind of Amazon.com internet access to a variety of private health insurance plans and giving individuals access to subsidies is quite popular. In Kentucky, of all places, there are just droves of people, tens of thousands of people who are signing up for Kentucky's state-based health insurance exchange. In California, we're seeing several thousand people a day or more signing up. And you go around the country where they have those state-based exchanges, it is working.
Opponents of the Affordable Care Act point out that unless a significant number of younger people sign up for the ACA, there may be financial problems down the line. In other words, the very few will be supporting the elderly, the folks who need more financial assistance. How important is it for President Obama to sell the idea of health care to a younger audience that may not be very receptive to that concept?
Very important that we move from the current insurance market, which is highly segmented, to a new community-wide insurance market in which we have a lot of different risks. What I mean by that is in the old health insurance market, that is the one that existed before 2010, if you were young and healthier, you got a lower rate. But if you were sick or had been sick, or you were older, or you were a woman, then you were charged much higher rates in terms of your premiums. And for some people, the insurance company dropped them, even after they paid their premiums. For instance, if you're a woman who got uterine cancer, but had been paying your premiums, there were some cases where those patients were dropped from care because it was expensive. Now we're moving to a whole new model, and the insurance companies are already there. They've already created these products where they're saying, come into a market where everyone's going to be treated pretty much the same. No more discrimination against women. Seniors are going to be charged a bit more, but there are limits on that. The pool then is not segmented. The challenge, though, is this transition. Will younger people, and then those who are healthy, come into a market where they're probably going to end up paying a bit more for their premiums? Now, there are a lot of reasons to think that won't happen. It doesn't seem that rational. But here are a couple things to keep in mind. One is that most Americans obey the law. And it is the law that you sign up for health insurance. We're also finding that in states such as California, Connecticut, that have their own exchanges and where they have data already available, that we're seeing pretty good turnout from young folks who are apparently buying the message of you need insurance just in case. You don't want to end up in an emergency room without insurance coverage. It's just not a good idea. The financial cost of that will be enormous.
With the 2014 elections about a year away, let's look at the political landscape. We have obviously Senator Al Franken up for re-election. We have every U.S. House member up for re-election. What are the potential consequences for the Democrats who have been supportive of the ACA, and perhaps for those three Democrats, Congressman Nolan, Walz, and Peterson, who voted, broke ranks with their party and voted with the Republican majority to make some changes to the ACA? How does it all play out for those politicians?
Well, there's no doubt at this moment Democrats are panicking. I think there is a kind of a sense we're going to give the president another few weeks. But the votes by the Minnesota Democratic triumvirate of Walz, Nolan, and Peterson for a House Republican bill that would have really put the Affordable Care Act on the skids is a powerful sign of that panic among Democrats. That's a big problem. And if the president can't get the federal exchange working, then I think we're going to see more and more Democrats deserting him. On the other hand, we are starting to see the exchange work. The news in the states that have their own exchange, like Minnesota, is increasingly bright. So here in Minnesota, we may see some efforts by the Democrats to talk about what has happened. For instance, Senator Franken sponsored a part of the reform that says to the insurance companies, you got to pay at least 80% of your premiums towards improving health or covering medical care. If you don't, you have to pay a rebate back to consumers. That's already amounted to $2 billion. Now that's a pretty popular element of health reform. So I think there are things that Democrats can point to, but it's going to require the president to get things in order in Washington.
Is it safe to say, or perhaps premature to say, that the ACA will be the #1 issue in the 2014 elections?
I think it's going to vary. In some states, if the Affordable Care Act and the federal exchange are working well, then it may not be as front and center as we might be thinking today. For instance, in Minnesota, will the Republican Senate candidate be taking on a highly popular health reform? If that's the case, I don't think they will be. But in other states like Wisconsin, where it's had a very rocky impact, it could well be front and center. So I think it's going to vary around the country depending on how well the president is able to rebound and on the success or the presence of state-based health insurance exchanges.
Professor Larry Jacobs, thanks so much for joining us again on Access Minnesota.
Good to be with you.
That's all for this month's edition of Access Minnesota. We'll see you again next month. Thanks for watching.
Access Minnesota. Issues that matter to you. Join us again next week as we bring you the newsmakers and stories that shape our everyday lives. Access Minnesota is produced by the Minnesota Broadcasters Association in cooperation with the University of Minnesota's College of Liberal Arts.